Hello, welcome to Healthy Kingston, a health promotion and wellness program offered by the Town of Kingston Board of Health. My name is Janet Wade. Today we're going to focus our program on the status of public health, nationally, statewide, and locally, particularly in the Town of Kingston. I'd like to start my remarks from a survey that was done by the Commonwealth Fund. It was published in June of this year. And it states that more than 1 million Americans have died from COVID-19, a toll that exceeds the total number of U.S. combat deaths from all wars since the nation's founding. The United States is also failing to protect millions of people from growing health challenges such as overdoses, diabetes, and maternal mortality. The scale of these challenges justifies the development of a national public health system to save lives every day and better prepare for future emergencies. The Commonwealth Fund Commission on a National Public Health System finds several facts that I'd like to share with you. Public health efforts are not organized for success, despite dozens of federal health agencies and nearly 3,000 state, local, tribal, and territorial health departments. There is not one single person or office in the U.S. Department of Health and Human Services to head and coordinate the nation's public health efforts. Public health funding is not sufficient or reliable. The chronic underfunding of public health has left behind a weak infrastructure with antiquated data systems, an overworked and stressed workforce, and laboratories in despair, and other major gaps. Expectations for health agencies are minimal, and funding is not tied to a set of basic standards for the capabilities of state, local, and territorial territories. The healthcare system is missing opportunities to support health improvement. It's difficult to convert collaboration with public health agencies during emergencies such as the COVID debacle we've had the last 2 years, and sustainable work to address just the day-to-day challenges that go on in health departments. The public health enterprise is facing a crisis in trust. This crisis relates to experiences with racism, discrimination, ideological opposition, and misinformation. The United States should build a national public health system to promote and protect the health of every person, regardless of who they are and where they live, and implement effective strategies with others in the public and private sectors. Respond to both day-to-day health priorities and also crises with vigor and competence, and in the process, earn high rewards for efficacy. Our administration should establish a position such as an Undersecretary for State Health at the U.S. Department of Health and Human Services to oversee and coordinate the development of a national public health system. Our administration should also provide adequate and reliable public health infrastructure funding, paired with expectations that states, localities, tribes, and territories meet standards for protecting their communities. And they should also fund a modern public health information technology system and provide Health and Human Services with the authority to make it work. Guide in all government approach to the drivers of health. And lastly, embrace ethics, integrity, and transparency in decision-making in public health. Access the structural and policy changes needed to provide foundational capabilities for all of our residents, and build connections between the healthcare system and public health to strengthen the day-to-day health department efforts and better prepare for emergencies. And there also needs to be a need to involve all of our community partners in health decision-making. Modernizing the public health in the United States is not a simple task, but it can't be ignored, particularly in light of what's gone on in our country the last 2 years. With all of that said, I would now like to introduce our local public health nurse for the Town of Kingston. Her name is Leanne McGuinness. Many of you have had the pleasure of meeting her. She has conducted the COVID vaccination clinics that we've had in town. She has started clinics at the Council on Aging and offered blood pressure readings and given presentations there, and has done a lot of home visiting in the Kingston area. So I'm very happy to have her to talk to us further about her role in the community and what she foresees as the status of public health in the town of Kingston and where she would like to direct her efforts in the future. So with that, Leanne, it's so nice to have you here. Thank you for being here. Leanne, personally and professionally, I feel very fortunate to have you here as our public health nurse in Kingston. And I think people, the greater public, should get to know you a little bit better and what you're all about. I know a number of them have met you at the clinics and some of the presentations that you've made. But first off, you are the first public health nurse we've had in Kingston. Yay. And you've set the bar very high. And I'd like to ask you, when did you first start the position and what got you interested in the position in the first place?
So I started as a contract public health nurse last June 15, 2021. The position became official as an official town employee June 6th of 2021. So I've been here now for a while now.
Can you tell us a little bit about your background, your professional background, what you've done in the past and where you are now? So
I've been in the healthcare field and in nursing well over 15 years. I have done home health care, hospitals, vaccines, lots of vaccine clinics. So I've been doing this for a little bit now. I have a lot of personal clinical experience as a nurse. And I know you had said you graduated with the BSN from Salem State? From Salem State University is where I got my bachelor's degree.
And you're currently in a nurse practitioner program at
Regis
College. Yes, with an interest in
mental health.
Terrific. Certainly health. Well needed. Yes, well needed in this area and everywhere, particularly during these times of pandemics. Why were you interested in public health and why this position?
So due to the pandemic, I was transitioned from home-based clinical practice to public health. The height of the pandemic, nurses were working long hours, risking their lives, and I was not working at that time. I made a decision to get in the solution as a nurse. That's what that's in our heart, it's in our body and our spirit to just, be part of the solution. And I started working as a volunteer with the MRC doing vaccine clinics.
What is the MRC?
Massachusetts Response Course, Reserve Corps. So it is for anyone that wants to volunteer. There's two sectors. There's a medical and then a non-medical sector where you can volunteer in any emergency response that's triggered in Massachusetts.
Okay. And why Kingston? What interested you in this town and this position here?
It was definitely, the need. They wanted to be part of the solution with vaccinations and open up vaccine clinics. So that's kind of what dragged me over to Kingston. The administrative end, the political end was great as well, working with the town employees as well.
And obviously you've spoken to your education and your qualifications, and certainly for those of you who aren't aware, you worked with the Marshfield vaccine clinics before you came here, didn't you?
Town of Marshfield.
Right.
Their fire department that's what showed me how a collaboration could work. Town Hall and the fire department worked together on rolling out a huge clinic at Marshfield Fair.
Which actually leads into, you're on a committee with the police chief and the fire chief. Can you speak to that a little bit, please?
Yeah, so they're over at the Council on Aging. There's a committee called the Triad Committee, and it includes the Council on Aging members. It's an open meeting, anyone can attend. The Sheriff's Department, police, fire, and district attorney, who meet monthly to share the concerns of health, well-being, physical safety, mental safety of the residents of Kingston.
What a wonderful effort to be able to get all those entities together. What do you think are the advantages of that? What have you seen come out of these meetings?
So working closely with all of the collaborations, has helped be able to tackle areas that are of concern in all different areas. Personally, working with the fire department and the police has been a great asset for the Board of Health. It's a great way for us to all communicate, share our concerns of the residents, especially the elderly residents.
Can you elaborate on that a little bit as to maybe some examples of things where you have collaborated that have worked out?
Yep.
Well.
So one of the, obviously we've been piggybacking clinics before and after. The one meeting that we met, we had a nurse come in and share fall prevention. So as you know, Janet, my heart belongs to, anything prevention, promotion, healthy, prevent disease. One of them has been falls, and obviously you're going to talk about funding. Being able to get funding to do programs, matter of balance, in these areas. A woman had come in, three areas, physical therapy, Beth Israel, and they gave a talk about, ways for us to be aware of, polymedicine, letting the fire department know if they're called for a 911 for a call, for a fall, like, things to expect. The police, everyone was able to be educated on reasons of falling and how to, prevent falls and how to, handle a situation if a resident falls.
Great. And I know there's been discussion on past programs about overdose cases and a collaboration of, again, the health department and the fire department and the police department as far as, ministering to the person, caring for them, and then following up after they've regained their health as to the counseling they might need. Have you been in on any of those situations?
No. So actually a local community, Plymouth, does a really great job, and that's what we're trying to piggyback their model as far as overdose and, Narcan education and prevention. So that is not something that we have been able really to tackle, again, due to funding.
Right. But hopefully, obviously, as you said, very important. And hopefully something will address, which feeds into what are your goals for this position and the department going forward, short and long-term goals?
So short-term goals would obviously be able to do more community-based clinics, health wellness groups. Right now I currently am tackling Alone Maven. So we work with the state, and we have to, any communicable disease, it's not just COVID. It's any foodborne illness, any tick-borne illness, making sure that the patients in Kingston understand that, there's treatments that are needed, that they're following up with their providers. We keep track of all of those. I would like to branch off more as a public health department, like in the health department, be a little bit bigger. I'd like to do more clinics, more one-to-one, more home check-ins for homebound residents as well.
Okay. And certainly education programs. And just for the sake of the public, so Maven is a tracking tool.
Yep. So
through the
Maven
state.
is a tool that the state released in 2017. It's a newer way for us to, get the information. So if you get a phone call from the public health department for any communicable disease, we basically have to do our job to make sure that, one, if you have contracted an illness or a virus, that we're following up, that we're checking. A great example is if you see a recall on peanut butter. That recall sometimes is generated through the health department doing their contact tracing on salmonella, on if I'm able to figure out, okay, Janet, you contracted a virus, and I go through your food log, and I figure out, I pinpoint what you ate, and we try to match it up with other local communicable diseases related to that specific disease, and if it was due to food, or if it was due to contaminated drinking water. and reasons. We try to make sure that you're getting the proper treatment that you need, that you're taking the medication that you need, and that if you even have the resources. There's been many times where I've had residents that couldn't pay for the antibiotic that they needed.
And I know you've advocated for them in getting the antibiotics.
Or I go and I pick
You
pick
go
it
and you
up.
pick it up.
They know me at Stop and Shop and CVS now.
Right. Yeah. Okay. That's a lot right there. So I would say your short-term goals are moving into your long-term goals, just enlarging
So
your
my
presence.
long-term goal would be to have a fully functioning health department with more than just a 15-hour public health nurse. You and I share a lot of the same aspirations of what we see of public health. As a member of Massachusetts Association of Public Health Nursing and American Public Health, I really believe, if we can tackle through prevention and promotion, it'll, decrease long-term diseases, diabetes, hypertension, definitely education for overdosing, working with the homeless, and there's so many areas and so much I'd like to see grow.
Yeah, it's such a widespread field, and I think people are only starting to realize how extensive a field it is.
Yep.
With all of that said, what do you want the community to know about you and what you do, and how to access you?
So we have rolled out, the town of Kingston has a wonderful website. We have a health department website. There is my email that's attached. It's very simple, bohnurse@kingstonma.gov. I answer all emails. If you have any questions or concerns, don't hesitate. If you think, any, especially communicable diseases, if you're looking to see where we're having a blood pressure clinic or any educational vaccines, anything, definitely email me. Also, we have a wonderful tab that we just started. It's the nursing tab on our website, and we're going to update it, and we're going to have a lot of information for resources, anything mental health related, any COVID, monkeypox, anything that comes up, flu, anything that comes up, you'll be able to access that through the website.
Wonderful. Actually, while we're on that subject, can you speak to monkeypox?
So monkeypox, yes. Kingston has not had any positive monkeypox cases yet. We have been working very diligently with the state. They are now asking the local boards of health to do any contact tracing, which would be anyone that is in contact with a positive monkeypox case. I will have to call for 21 days. I will have to, as long as they have no symptoms, I will monitor them for 21 days for any flu-like symptoms, any bumps, rashes that are of abnormal. To the resident, I will fevers, go through everything that needs to be to kind of like what we did with COVID, screening, checking on them. So that will be my job for monkeypox. There is a vaccine that is available. You would have to contact your provider. We are not going to be doing monkeypox vaccines at this moment. That is at the state level. So that is, call your provider if you feel like if you are in need of the vaccine.
Cases in Massachusetts, not extensive.
No, I think we had like 47, around 47 cases, none in Kingston.
Okay. So people can limit their concerns on monkeypox at the moment. COVID cases.
COVID cases. So we had 37 positive reported COVID cases. The great thing about at-home antigen tests are we're able to get tested quicker, isolate sooner, but they are not reportable to the public health office nor to the state. So there's just no knowing the number. I did run a variant of concern report. We are surfacing Omicron into Kingston, so that seems to be the common variant of concern as far as COVID.
And vaccine for that in the future?
So, hopefully we will have a vaccine that will, in Kingston, again, check our website. It will always be updated on clinic times. We will have one September 21st, Wednesday, September 21st. Make sure that's the right. From 6 to 8 p.m. at the Council on Aging. Again, you can feel free to reach out, and I can, if you're a homebound resident, I can, answer any questions you have about that. The goal is to hopefully be able to target, kind of like we do with the flu. We're able to target the variant of concern, to protect people and keep them as healthy as we can and out of the hospital. That's our goal.
When do you anticipate offering the Omicron vaccine?
That hopefully maybe September, October.
Okay, and you'll let us know.
Yes, it's all a wait on vaccine.
Okay. And just a little push for your articles on the website.
Yes, so we have already rolled out, we're going to do monthly topics, which will keep in line with the topic of the month. We actually have a very wonderful opportunity where we're going to be working with Mass General to have students. It's going to be nice. It's going to teach them that, people think when they take a public health class for nursing, it's just, you're going to go to a school and you're just going to give out medications. School nurses, too, have been more than just medications and Band-Aids, especially this past year. We've been able to work with the local school system, and they have done a tremendous job working, making sure to keep the kids safe and the community safe. So now we're going to roll out a part of the website which will include information on kids and, children in safety, bike helmets, up to date for car seats, just information that parents can have access to resources. The students are going to help tackle, monthly topic around, each month we'll have a separate topic, and we're going to try to get out as much accurate information and up-to-date information as possible.
Great. Well, thank you so much again for all that you do for the town. It is very much appreciated, and I know that you certainly keep up with the data and with the state as far as any new trends, any new concerns, any new treatments, and that's very much appreciated by all of us. So thank you. I did mention at the beginning of the program that we were going to address local and statewide and national. We've addressed national concerns and local concerns, and now I would like to address what's been going on with the state as far as public health and what we're going to be doing and entering into what they have to offer. The town of Kingston back in April was awarded a public health excellence grant, and we are the lead town on it since we helped with the application. The other towns that are associated with this grant are going to be and are Plymouth, Carver, Wareham, and Halifax. And we have now been meeting as a committee every 2 weeks, representatives of the towns. They're primarily the health agents from the towns who are meeting and looking how we can further collaborate on services and where the gaps are in services, public health services in the different towns. So there will be a survey that will be done later in the summer, looking at where those gaps are and local resources that can address those gaps, and people that can be hired, be they sanitarians or public health nurses, food inspectors, to help address the needs in the particular towns that are part of the grant. So we're very, very excited about that. Also, to update you on what we're doing locally, not only are we the lead town on the Public Health Excellence Grant that's funded by the state, but we have our public health nurse, Leanne. We have a very active board of health that has been addressing a number of issues. If you want to keep up to date with what all of those are, they're in the minutes that are posted on the town website. and we're looking at them on a regular basis, and as concerns comes in, we certainly address them. We have a new health agent, Paula Rossi Clapp, who has come in and is doing a wonderful job organizing the department and getting all of the particular accreditations that she needs for the department and for herself to keep us current and up to date on what we need to do to best serve all of you. And one last thing, Leanne had alluded to it, we are working with nursing students. These are accelerated Bachelor of Science in Nursing students from Mass General, who are going to be working with Leanne and our health agent Paula throughout the fall in different health efforts in the town, be it at the Council on Aging, vaccination clinics, and the Public Health Office. So again, bringing in further expertise and looking at our local resources and how we can expand upon them further. So with that said, thank you so much for joining us, and stay happy, healthy, and safe.